Welcome, participants, and thank you for coming from all around the world to celebrate World Accreditation Day. Accreditation has a unique role to play in healthcare quality, especially now with climate change impacts are being felt more intensely all around the world. And it helps leaders to focus their efforts for providing a sort of trusted framework to identify, implement, and scale the right climate and sustainability actions. So welcome. I'm John McGraw, the Executive Vice President of Products and New Business at Accreditation Canada. And I'd like to start off today with a land acknowledgement, just to acknowledge where we are. So today, we acknowledge the significance of the land in which we stand. Accreditation Canada, Ottawa's head office, is located on the unceded traditional territory of the Algonquin and Anishinaabe Nation. And I'd like to express my respect and humility and gratitude to the Indigenous peoples who have cared for all these lands for countless generations. So I'd like to talk a little bit about, just introduce you to Accreditation Canada and our mission, vision, and why we're here, and also the theme of climate resiliency, partnership, and why health accreditation is so important. So patient care is incredibly important. And patient care and resilience are all the same thing. Because a system needs to be resilient to handle perturbations across different systems. And we need to prepare for extremes that will, in any situation. And right now we're facing a lot of extremes in both emergency and non-emergent times. So we are focusing on resilience in accreditation because it's about preparing for emergency, mitigation, and the damage when it happens, and bouncing back quicker with less impact. And these emergencies may happen due to climate or conflict. They may be a result of natural disasters or man-made disasters. And this could affect supply chain, healthcare, a number of things that could be impacted. And so it's summer in the Northern Hemisphere, it's approaching summer, and so we're focused on heat as a way to appreciate what must we take on with regard to accreditation and the tools we have to help mitigate some of these challenges. So today is really part of a growing community in this space. Many of us joined us on April 30th in Montreal for the Synergy Conference that brought together national leaders in health and talk about climate resilience and also accreditation and tools associated with that. Our new CEO, Frédéric Abigail, regrets not being able to join us today, but wanted to really participate, so he prepared a short video to help us get us started. So we'll begin with that.
Greetings. A powerful movement is underway across healthcare, with organizations coming together to take meaningful action on climate change and sustainability. Thank you for joining us today and for being part of this growing community committed to improving healthcare quality and long-term system resilience. I wish I could be with you live today. While I'm unable to join in real time, I'm delighted to welcome you to this global webinar marking World Accreditation Day and to highlight the important work you will be exploring together. Today's conversations builds on the national dialogue from April's Interregional Forum for Sustainable Healthcare in Montreal. Healthcare leaders from across Canada were clear. Climate change is adding a new level of pressure, amplifying existing challenges, and exposing the limits of our current healthcare models. One message came through strongly. Meaningful change will require rethinking how health systems are designed, delivered, and supported. And that work starts with understanding where you are today in your climate action journey. Climate resilience is central to that work. In healthcare, it means being prepared, reducing risk and impact, and recovering more quickly from climate-related events. This is why emergency and disaster management plays such an important role. At Accreditation Canada, we see a vital role for ourselves in supporting health systems' adaptive capacity. We help organizations build practical roadmaps, we foster a community that shares what's working and what's being learned, and we align our assessment programs to support real progress. Today, you'll hear more about our Climate Action Maturity Assessment. This represents a critical first step, helping organizations understand how climate action aligns with existing accreditation expectations. This approach reinforces an important principle. Climate action is not separate work. It is embedded across leadership, emergency preparedness, operations, and clinical practice, with clear alignment to standards and required organizational practices that improve patient outcomes and population health. In this way, accreditation helps drive value-based healthcare and innovation while supporting health systems to become more climate resilient. I want to close by thanking our impressive lineup of speakers for sharing their leadership and insight, and by thanking all of you for joining us today. Together, we can build a stronger, connected community committed to advancing healthcare quality and sustainability for the future. Thank you.
Well, that was a wonderful message from Frederick. As he mentioned, healthcare quality and resilience and building on that is about building also a community. And a community is really important to provide the dedicated work necessary to put the systems in place and to see the impact of quality systems, not just when a system's working well, but when it's under stress as well. And so we've assembled a panel here today that will talk about their experiences. We're really pleased to welcome Chris Johnson. In our webinars and all that we do, patients are first and foremost. That is what is so critical to the delivery of healthcare, is why we're here. And we're pleased to welcome Chris as a patient partner based on Vancouver Island with experience across healthcare, emergency management, and quality improvement. Since 2018, they have contributed to research, governance, health informatics, and artificial intelligence, and now supports the national standard on climate resiliency and emergency and disaster management. We're really pleased to have Chris with us today. Next, we also have Dr. Courtney Howard. She is an emergency physician in Yellowknife, a clinical associate professor at the University of Calgary, and the chair of the Global Climate and Health Alliance. She is the founder of POWER, Planetary Health Organizations for Wellbeing, Equity, and Regeneration. She led the roadmap for planetary health and sustainable health systems, which has been endorsed by all Canadian faculties of medicine. An internationally recognized expert on climate health, she advances climate resiliency care through frontline practice, research, policy, and system leadership. She is also the 2027 president-elect of the Canadian Medical Association. Next, we have Dr. Miles Sargent, who's a family physician and environmental advocate who serves as executive director of the Canadian Coalition of Green Healthcare, leveraging over 25 years of experience working with vulnerable populations and leading initiatives that integrate climate action into healthcare systems. And we also have Judith Edenbrod. Judith is a senior program manager for Health Equity and Health Standards Organization, an affiliate of Accreditation Canada, where she leads interdisciplinary efforts to strengthen health systems and advance healthcare quality. With a background in Indigenous health, environmental sciences, and public health research, Judith brings a rich blend of expertise in evidence-based decision-making and equity-driven program development. We're really pleased with this lineup we have today. And for some people, it might not maybe be a surprise that we're going to be talking about heat, given that we're coming from Canada. But all these panels will have significant perspective to contribute about this, which we'll get to in a little moment. But first, a little housekeeping. At the bottom of your Zoom screen, please select your language of preference, either English or French. We are offering simultaneous translation for French interpretation of the English presentations. The recording of this webinar will be made available. During the session, please use the chat function on your screen to share insights. Use the QA function to ask specific questions or make suggestions for future areas you may wish to cover. So today's objective and background. Today's event will focus on what health leaders can do to drive impact in better quality of care and climate action. Accreditation offers a trusted framework for choosing the right to green innovations for improving results. These green innovations may be cost reduction, may ameliorate future cost increases to mitigate damage, may be better for patient care. And we're introducing a new climate resiliency and tool and standard. We're announcing a new emergency and disaster management standard, and they're renaming it the Climate Resiliency and Emergency and Disaster Management that will help organizations build adaptive capacity and resilience. With this, I'm pleased to join by our speakers to discuss how accreditation can drive across climate action and resilience, share learnings from various initiatives, and perhaps most importantly, highlight opportunities for collaboration across health systems. I think it's really important that we start off understanding the patient perspective and the patient journey. And as Chris Johnson, our patient partner, is going to talk about their journey in a heat environment, which is applicable to many areas around the world. Chris?
Many thanks, John. My name is Chris. I'm an Irish immigrant and settler, grateful for the opportunity to live, to learn and volunteer on the ancestral and unceded lands of the Coast Salish peoples, the Lekwungen and Wasanich nations, in the area known to settlers as Victoria in BC. I was born in Ireland to a working class family of 9 siblings, all born prematurely and with deficiencies that were all too common in communities where working class was a euphemism for poverty. My parents were hardworking, resilient people who, despite raising a brood of kids with complex health issues, managed to ingrain in us the notion that hard work is its own reward. During the recessions of the 80s and 90s, most of us emigrated to find work abroad. What I remember most about living in Ireland, and sometimes what I miss most, is rain. We talked about weather constantly, rain being the lifeblood of a country that depends heavily on farming and is excessively proud of its many shades of green. But I don't remember climate ever really being a topic back then. When it was my turn to emigrate, I went to Guernsey, one of a small group of islands between England and France, a little further south than Ireland, basking in the residual warmth of the Gulf Stream. Guernsey weather was a little warmer, a little drier, and a lot foggier. Weather was still a constant topic, with both tourism and finance depending on transport links that were often impacted by fog. Although climate was now an occasional item on TV or radio, it rarely entered daily conversation. It was in Guernsey that I met my partner, and a chance advertisement in a Sunday newspaper brought us to Canada. And so the dream of living here was born. Over 10 years later, in 2005, we emigrated to BC, settling on Vancouver Island. Despite being caught off guard by substantial snowfall in our first winter, the weather was somewhat drier than we'd been used to. In the first few years, we noticed a distinct improvement in my partner's asthma, which was very welcome. Climate as a topic was gaining momentum, but it wasn't until we'd been here nearly a decade that less desirable health issues surfaced. Around 2013, excuse me, we began to pay attention to wildfire smoke drifting across from both mainland BC and Washington state. My partner, who enjoys walking 10 to 12 kilometers a day, is loath to allow weather of any kind to interfere with that routine. But increasing episodes of wheeziness and inhaler use couldn't be ignored. It became necessary to time walks carefully during wildfire episodes, sometimes abandon walking completely for several days at a time to minimize smoke inhalation. The information we needed to coordinate that wasn't easy to find. And even now, it's not targeted at people who are trying to stay healthy through exercise during the wildfire season. A few years later, we took a ferry to Vancouver, intending to drive to Kelowna to stay with friends. It was early in the season, so forest fires weren't yet on the radar, and as we began the trip, the skies were clear. But the further east we drove, the more pronounced the smoke became, and eventually we halted to take stock, wondering if we should call ahead and cancel. While we hesitated, our friend called. Her husband's COPD had taken a turn for the worse due to the smoke, and they had decided to pack up and head south to stay with their daughter, and asked if we could help move their pets, which we did. Long before any official evacuation was called, and in the absence of any direct healthcare communication, the smoke was forcing people to make difficult choices about leaving the area if they could. Excuse me. A couple of years later, I didn't hesitate to volunteer as a patient partner for what was then the emergency and disaster management standard, because the need seemed all too apparent. In the years that followed, we became acutely aware of higher temperatures during the summer months. We live in a small apartment with poor airflow, and as the heat rises, it exacerbates existing symptoms of fatigue, pain, blood pressure, dizziness, headaches, and sometimes disorientation and confusion. Without adequate public warning or information, finding ways or places to stay cool can be problematic. So not long ago, we conceded defeat and bought a small portable air conditioner to keep a corner of the apartment livable, though I am conscious of the inherent contradiction in that solution, since air conditioning and the additional power it consumes only adds to the climate problem. During the pandemic, of course, climate became an even more important topic, since climate change, in part, contributes to the spread of certain infections through the migration of animals and insects as disease vectors. My parents had moved from Dublin to a small cottage in the Midlands of Ireland not long before the pandemic, and naively I believed that they might be safer there than in an urban setting. But I soon became concerned with frequent water outages. Searching revealed that a long-term project for regional water mains renewal had been very poorly communicated with those affected, and so I found myself tracking planned outages to alert my parents in advance, thinking that the biggest risk was dehydration, since they were both in their 80s and growing frail. It was quite some time before my mother confided that they'd both been poorly, not with anything respiratory or COVID related, but a mysterious stomach bug that kept recurring. I wondered if it was related to the water mains project. She insisted it had started earlier, coinciding roughly with their move to the area. Then came the shock that my father was dying. His cancer diagnosis had been substantially delayed by pandemic lockdowns and lack of access to primary care. His GI symptoms were initially dismissed as cancer-related, and sadly we lost him a few months later. But my mother's symptoms persisted and were again dismissed, this time as triggered by anxiety and depression rooted in grief, despite the fact that they'd been present long before my father's passing. So I dug deeper and eventually learned that the water mains project had been initiated in response to a growing contamination with cryptosporidium, a waterborne parasite causing fever, stomach cramps, nausea, and diarrhea, especially dangerous for the elderly and the very young. The parasite had flourished in rising temperatures, and increasing flooding over the previous decade had caused runoff from agricultural lands to contaminate natural reservoirs for the local water system. Testing confirmed my mother's symptoms were indeed caused by cryptosporidium, but sadly we lost my mum a few months later from a fall, from which she was by then too frail to recover. Climate change undoubtedly contributed to the loss of my parents, but failure to adequately inform local residents and health professionals of the cryptosporidium issue seriously impaired their health and quality of life during their last few years. Not surprising then when the opportunity came to participate in the newly integrated Climate Resiliency, Emergency and Disaster Management Standard, I jumped at the chance because I've come to realize that the lived experience of patients and caregivers is vital to navigating and mitigating the climate impacts on our health systems. In recent years, climate change is a topic that has rarely been out of our headlines or our conversations. And yet, despite all the talk, we still seem ill prepared for the health impacts at both the individual and the systems level. So I'm grateful for the opportunity to contribute as a patient partner to strengthening the resilience and readiness of our health systems. And also grateful that Accreditation Day is highlighting this theme because the time has come to move beyond simply talking and into taking action. Thank you.
Thank you very much, Chris, for those very powerful stories. And I think it really highlights why the Accreditation Canada, we focus so much on the patient's perspective. Hospitals and their just focusing on one institution and for accreditation does not necessarily highlight the challenges through a health system and a patient's journey through that system that may, if we have better communication tools, better awareness, may help prevent people from needing to go to the hospital and cause some of the challenges in various aspects, whether it's a disaster or whether it's, as you said, waterborne infections. So I really appreciate the time you've taken to tell us your story. Next up, from a different perspective, Dr. Courtney Howard is going to share her real-world clinical experiences. Dr. Howard.
Hi, thanks everybody. I'm coming to you from Yellowknives Dene territory in the subarctic, and my internet connection seems to be a bit unstable. So if I disappear for a moment, I apologize. So these are the traditional lands of the Yellowknives Dene and the North Slave Métis, and we are warming at triple the global rate. We are already 2.5 degrees Celsius warmer than we were when an 80-year-old elder was born, and have the only CT scanner in the whole top part of Canada in the middle. And what that means is that some of my patients are already experiencing temperatures more than 3 degrees Celsius warmer than when they were born. And that's leading to unstable ice, trouble hunting and fishing in traditional territories, and real very, very profound changes in the landscape with permafrost slumps leading to sometimes lakes actually disappearing and mental health challenges associated with that. Solastalgia, known as feeling homesick when you're still at home due to landscape change, is a real feature here. Next slide. And so I started working at the intersection of climate change and health in 2009. Next slide, please. And what has happened is that at the beginning, it turned out that we really did not have any expertise as a health community. It was a emergency that had been very poorly taught in medical curriculum. And that's still the case, although things are getting better. And what I now understand is that I go to work every day, and as an emergency physician, I help to resuscitate the complex adaptive system that we each walk around in every day. And we know that the heart affects the lungs, affects other organ systems. And we kind of have to look at the whole system if we want it to be well. The same is true of the complex adaptive system that we walk around on every day, Mother Earth. And so what elements are essential to the Earth system stability? Next slide, please. The way we now look at the Earth system is in understanding, next slide, please, the planetary boundaries as being the place where the Earth systems go from being stable to unstable. And unfortunately, the Earth system as a whole is now, I would say, semi-stable. We unfortunately have gone out of the safe operating area for 7 of the 9 systems, including climate change and biodiversity, which are thought of as the most essential core systems. And we've only demonstrated improvement on one, which is ozone. But in fact, that's encouraging because that took international cooperation, clear targets, interventions that worked with industry. And so that's really what we need to do in order to get the Earth into a position of stability. But what that means is we're already starting to see changes. So we're seeing increased heat waves, et cetera. And these are changing the patient populations that show up in the emergency departments where we work. This is where I work here in the subarctic. Next slide. And so what we find is that, in fact, as the ecological foundation of all of our civilizations and our health systems becomes unstable, we're seeing new patient presentations. And so heat-related illness is going up around the world. That can make wildfires more likely. Smoke from wildfires increases cardiovascular disease as well as chronic obstructive pulmonary disease exacerbations, as we just heard, asthma exacerbations. We're starting to understand it probably has impacts on cognition, potentially neurodegenerative diseases, premature births, etc. Evacuating from wildfires is associated with anxiety, PTSD, etc. We're seeing changes in essentially habitat for different vectors, mammals, etc. And um, as beings who have diseases move around in response to habitat change, sometimes they come closer to us, and that makes it more likely for us to have transmission of diseases into human populations. Malnutrition is thought to be one of the emerging most severe acute risks of climate change. Pediatric malnutrition is close to my heart. I worked in Djibouti for 6 months treating that. And of course, all of this can be drivers that can make conflict and migration more likely. Next slide. And we need to understand, we sometimes think of this as an environmental problem, but in fact, the environment is not an entity that exists lateral to work in the hospital. It's the foundation of what we do as well. Next slide. And all of what we do depends on a functioning ecological foundation and social foundation. We need supply chains to work. We need the education system to work. We need to have healthy staff who come to work. And all of those are put at risk by a destabilized ecological foundation. Next slide. And so what's happening in the emergency department is that not only do we have more patients, but our ability to run our operations is threatened. And that can result in, for instance, direct heat stress to inpatients, decline in indoor air quality in our facilities. We actually had a neonate in our hospital who was trying to sort of get better from a respiratory standpoint, despite a PM 2.5 of over 100 in there last week. And there's actual risks to the health of staff as well. Next slide. And so it doesn't really matter what issue you're trying to tackle in healthcare or what you consider a priority, all of them. And I'm just putting some priorities that we've talked about in Canada down the left-hand side. Next slide, next slide. All of them need to take a climate lens. And that's why I'm so very grateful to Accreditation Canada for the work that it's doing. Next slide, next slide, next slide. So you can see sometimes people will tell me, well, this isn't a priority. You explain to me how anything that we do doesn't need to take climate change into account. All of it does. Next slide. Unfortunately, we have a lot of experience with this here in the north. In 2014, we had 2.5 months solid of wildfire smoke resulted in a full doubling of emergency department visits for asthma. You can see what it looks like. It's actually, people used to just say it was depressing. We now have studies that show that people really do feel more anxious when it's smoky. People have trouble concentrating. It's hard to sleep in some cases. Next slide. So this has really profound impacts on a population, especially if they're trying to stay active, as Chris was mentioning, because the public health advice is usually to stay inside with your windows closed. Well, it's hard to exercise indoors all the time. We now know that healthcare needs to be part of the solution as well. So we'll mostly talk about climate resilience here, but I do want to mention that there is an opportunity in decreasing our own greenhouse gas emissions as well. So we know that about 5% of global greenhouse gas emissions are as a result of healthcare. And we need to actively lead the decarbonization of supply chains, of electricity, of transport. And we can do that because of our procurement power. We allocate globally 10% of global world products. So our ability to affect policy and markets is massive. Next slide. And we need to because the WHO is clear in its advice that we can't adapt to where we're going. Next slide, please. Luckily, we're finally taking action, next slide, at a global level. At COP26, we got 52 countries signed up to climate resilient sustainable healthcare. That number has now grown to over 100. So thank you to everybody online who has helped to contribute to this essential movement. And at COP28, we actually had 49 health ministers show up to tell us their initial plan. That kind of international norm setting can then lead to inspiration in countries. So we brought that back to Canada, passed the Academic Health Institutions Declaration on Planetary Health, next slide, which we are implementing via the Roadmap for Planetary Health, which was mentioned earlier. Next slide, next slide, next slide. So we're making progress. However, the Earth system is becoming more unstable as we speak. So it's still going faster than us. So we need to accelerate our efforts. Next slide. This is unfortunately my hospital evacuating in 2023. We have this roadmap for planetary health, and this was a recent Senate gathering here in Canada. I'm just so heartened. Dr. Nicole Revers, Indigenous scholar, was there. We are starting to see decision makers pay attention to this. Next slide. And we had Johan Rockström present. And what was alarming about that, next slide, was that we've overshot 1.5 degrees Celsius, the lower bound of the Paris Agreement. It is not good. We're entering tipping point territory. So it's yet one more reason. Essentially, we don't know what the Earth is going to do next. It's actually showing impacts faster than we thought it would. And so at this point, we need to really move from what I think has been in healthcare a culture of efficiency to one of resilience, build a buffer so that we're ready no matter which tipping point we may see tip. Next slide. Next slide. This is Johan Rockström scaring everybody, but it's worth it. It's normal to feel scared at some of this news. Like any bad news, like Ebola, like other infectious diseases, we need as leaders to cope with our emotions so that we can grapple with the information, make concrete plans, and move forward. And I'm just so grateful to Accreditation Canada for the work, because when we took a look nationally at our best federal lever to get everybody to move, it was in fact the accreditation standards. Next slide. So I've been honored to be part of the technical committee for the emerging disaster standards. Next slide, please. And I actually think that we're going to be needing to move quickly. Next slide, please, to upskill. And we're going to do that through the creation of a National Resource Center. Just want to really give John a shout out for all of his good work, because I love it that his strong, rigorous standards are coming, and that can actually help us motivate everybody else to learn what they need to do so we can keep our patients safe. All right, thank you very much.
Thank you very much, Courtney. I think really highlighting, we've heard the patient's perspective and we've heard the staff and hospital, but also how important the supply chain is as well in terms of the choices we make, but also in disasters that may have an effect as well too, and how this is a global issue and we're all coming together, and accreditation is a great framework in which to help achieve some of our goals. So I really appreciate that in regards to serving the patients, and as we heard, staff may turn into patients too, with the in certain emergency situations. Next, we have Dr. Miles Sargent, and we're going from, I think, a sort of a rural, remote perspective, Northern Canada, to in the city perspective. So, Miles, why don't you? We look forward to hearing what you have to say.
Thank you, John, and thank you, Courtney. Thanks to Accreditation Canada for having me here today and for hosting this event. And thank you to all who've joined us today. I want to start by saying There are lots of solutions. Unfortunately, I am going to dive back into problems first, but there are lots of solutions. So we have a heat problem in Canada. Heat is the #1 cause of climate change-related death. Vulnerable groups include the elderly and those with chronic physical disease or chronic mental health disease. And we're clearly not as hot as other countries, but our communities are not prepared. Next slide, please. Radio Canada did a demographic analysis of land surface temperature in Canadian cities, as you can see here. This is my city, Hamilton. It is one of the 5 hottest cities in Canada. I also happen to work with the poorest populations in town. And as you can see, there's a clear relationship here between wealth and heat. My patients all live in the areas which are shown in the top left corner, the hottest parts of the city. My patients are underhoused and often suffer, again, from chronic mental health and physical health issues. Next slide. This is a Google image of one section of Hamilton. I could show you many of these. Our tree cover is very low in the downtown parts of Hamilton. You can imagine that this particular area is what we call a heat island. There's lots of concrete and not much vegetation. This area is also at risk of flooding. Where can water be absorbed? And there's minimal air filtration by trees of local pollutants. And another big issue, where do the children play in this area? We need nature-based solutions. I did start a tree planting program 14 years ago, and we've done over 100 community plantings. But today, it seems like a drop in the bucket. How do we keep our population safe without people requiring emergency services during a climate event? Next slide. To solve this problem, we need to focus both on mitigation and resilience. We need to decarbonize fast so our global temperatures don't go up further. And we also need to prepare for all the climate risks which we already have. Next slide. So I will start with mitigation. We created a low carbon fruit tree, which was both for clinicians and for the C-suite. This is a theoretical 200-bed hospital in Canada. Each fruit is an initiative you can take at your facility. The orange fruits have over 100 tons of CO2 reduction per year if you take them on. We also show the cost savings on the left. The expensive items are at the top, like a new net zero building, and the cost savings ones are at the bottom. Prescribing less medications, as an example, is good for patients in terms of harms. I work at a hospital, a chronic care hospital, where our patients come to us on 19 medications each. By decreasing medications by 5%, hospitals can save $500,000 per year, and it's also an orange fruit, over 100 tons of CO2 per year. You're welcome to have this slide. I'm moving through things quickly. Next slide, please. There are 20 fruits on the tree, which I just showed you, but there are many, many things which can be done. Here is a solutions atlas, which we are creating, an engineer in our group, William Gagnon. This is an evidence-based catalog of climate solutions for health systems. Check it out and let us know if you have solutions you want to add, because after all, we're all in this together. Next slide. There are leadership and facilities pieces to climate solutions, but if you can get your clinicians motivated, there are hundreds of solutions. We reached out to our friends in England about their sustainable QI program they've been running for a number of years. We all think about quality improvement in healthcare. Why not add the sustainability lens to your next project? Good for patients, good for cost, and good for the planet. Next slide. Now I will pivot to resilience. We need to protect our populations now, today. Why? Because this is a health issue. Here are some of the climate health issues facing Canada. And if you're hoping for more from Courtney, here's more from Courtney. This is a map she created with some friends a number of years ago showing the various climate issues we face, including vector-borne diseases, hurricanes, drought, relocation from coastal erosion. There are many issues. Next slide. We spend a lot of time working on creating an ideal green hospital, circled here. But in a crisis, we need to think beyond our walls. This is a view of an ideal green community. There are a number of different sectors here: food, energy, supply chain, transportation, as well as community clinics, the pharmacy, long-term care, and home care. What resources does your community have? Do health care providers educate their patients? Are home care services adequate? Can the most vulnerable access the cooling centers? Do hospitals and paramedics integrate with vulnerable populations? Lots of questions. Next slide. Again, there are lots of solutions. Here is one community-based solution which we're working on. This is the Heat Health Project, which is funded by Health Canada. What solutions are there for vulnerable populations during a heat wave? There are solutions for the individual, like cooling kits and water access, and simply knowing and watching out for your neighbor. Solutions for buildings, like window shades, planting more trees, or creating a green roof. And policy solutions, ensuring health education, creating facility alert systems, and doing risk assessments. Next slide. Here is our climate action approach, which we're going to go a bit more detail on. This is created by Accreditation Canada and the Canadian Coalition for Green Healthcare. It involves collaboration, measurement, and standards. How prepared are you now, and what can you do in the next year? This will be reflected in our new scorecard coming out in a month, and I'll now pass it on to Judith. Thank you.
Thank you, Miles. I think what's really something we should acknowledge is that, we've talked about, rural, we've talked about remote, we've talked about urban, and the challenges from heat to parasites to smoke to water. All these challenges are, all countries around the world have similar type of challenges in different degrees. And this is just a microcosm of what's happening around the world. And so I think really, from an accreditation perspective, is thinking about, as Miles said, think about what you're doing from a green perspective. And what we're doing at Accreditation Canada is thinking about that, not just about accreditation health alone, but health in a more resilient way. For example, Miles mentioned the deprescribing is it's better healthcare about people coming in with 19 medications. That's not pills, that's medications, or that's not, that, and trying to keep track of that and the drug interactions, that is really a challenge. But it's also an environmental challenge, and it's also a supply chain challenge when you think about in a natural disaster, an emergency. If drugs are not available for people, then that's also a problem, or if therapies are not available. And so deprescribing enables other people to have those as well. And so to help make those decisions and think about actively what projects you may have, I think Judith is going to talk about it from Accreditation Canada and what perspective and things we can do. So Judith.
Thanks so much, John. Thanks everyone so much for everything that's been shared so far. So just to build on what Miles has shared as well. So in January 2025, HSO and Accreditation Canada released its declaration on climate action. And part of that work was to partner with the Canadian Coalition for Green Healthcare to develop a climate action program. And that program really leverages standards, collaboration, and measurement to create the biggest impact in health systems through accreditation, recognizing the power of accreditation as a lever. The Climate Action Program drives impact across all levels of an organization, from boardroom to direct patient care, and provides opportunity for the collaboration and conversations with patients and the community members. The program helps organizations to identify challenges and focus on priorities, and then develop the framework to drive impact. Part of that is measuring what you're doing today and what you can do in the future. We set the foundation for it all through evidence-informed standards and assessments developed with current international evidence and subject matter experts. Together, through collaboration, we'll be able to drive impact at individual organizations, but also across health systems. And as others have said, it's important that collaboration is so key. Next slide, please. So the Climate Action Program launches this summer and consists of 3 interconnected pieces. So building on and aligning with standards and required safety practices, the Climate Action Maturity Assessment serves as the entry point to the program, providing organizations with a starting place to assess where they're at across 11 key domains related to climate resiliency and sustainability. The Innovation Award not only allows organizations to be recognized for their leadership in climate action initiatives, but as importantly, allows others to learn from their work. Continuing the path of knowledge exchange and collaboration, the workshop brings together those working in the field, looking to build their capacity and learn alongside others on how to implement projects that improve patient safety, provide cost savings while contributing to climate action. Next slide, please. So the Climate Action Program is there to enable organizations to set those priorities for action, measuring success and progress year over year by making small changes with compounding impacts. Through alignment with accreditation and standards, the program creates the spaces to have conversations about climate resiliency and sustainability within organizations, with peers and partners, really providing that space to grow and learn from each other. Next slide, please. So HSO develops national standards of Canada that embed the latest evidence and best practices, including the International Society for Quality in Health Care, or ISQA as it's otherwise known. Our standards include targeted outcome-focused recommendations or criteria, which are implemented through Accreditation Canada programs. So implementation of these standards for participating in accreditation is the first step in assessing current state and opportunities for improvement. And there's many criteria that now include climate resiliency and sustainability as part of the accreditation pathway. The Climate Action Program provides further tools to support you on that journey and support the commitment to improving the quality of healthcare in your organization. Next slide, please. So in alignment with content in our standards and other quality improvement tools, including RSPs, the Climate Action Maturity Assessment is comprised of 11 broad themes. And as others have already mentioned, part of that work is the development of the Climate Resiliency, Emergency, and Disaster Management Standard, which will be available for public review and input later this summer. So please sign up if you would like to review that standard and provide your feedback. And the other standards and RSPs have been developed to incorporate climate and environmental sustainability practices. So that allows Accreditation Canada clients to be assessed against these criteria and get a head start on their climate action priorities while working within this tool as well. And in addition to aligning with standards and RSPs, these themes also align with work being done by experts in the field, and resources and supports are aligned with each section and are included as part of the Climate Action Maturity Assessment. Next slide, please. So the Climate Action Program allows you to assess where you're at and measure progress over time to continue to drive impact. Accreditation demonstrates that processes are in place, and these are validated, and the results demonstrate impact. And then Climate Action Maturity helps make choices, identify priorities, very much in line with what the peach tree that Miles just showed earlier. Next slide, please. So the Climate Action Maturity Assessment was based on the Canadian Coalition for Green Healthcare's Green Hospital Scorecard, and it really provides a simplified approach to climate action into a single tool. With 45 questions, once again, taking an opportunity to take stock of initiatives that are perhaps already underway and formally measure their impact, or perhaps give you some ideas from other new ways that you can advance climate action in your organization. We understand that healthcare organizations have finite resources and need to see an impact on direct patient care and a return on investment. And this tool allows everyone to see where there is space for improvement at all levels of maturity and all across the organization. We piloted a tool over the summer of 2025 with 63 hospitals across Canada and Belgium, and incorporated that feedback into this iteration. We've heard a lot today about the panel, about what the importance of building resilient health systems. I've pulled out some examples from a section of the Climate Action Maturity Assessment to show how some of these themes are being addressed and explored in a section that focuses on climate resiliency. Next slide, please. So in addition to the Canadian Coalition for Green Healthcare, one of our first partnerships was with the Geneva Sustainability Center to align our work with Geneva Sustainability Accelerator tool and really emphasize the importance of equity and considerations in this work as well. Next slide, please. And what's clear from all of our work is that perhaps most importantly, collaboration is key in climate action initiatives. Starting with interprofessional collaboration across facilities, clinical teams, patients and families, and community, but also collaboration with system partners, organizations can lean on partnerships to enable change. Next slide, please. So it's so great to see such an incredible number of people here today listening and taking that step to start building and thinking about what climate action means for their organization and building that capacity for collaboration and partnerships. So hearing from fellow panelists today really affirms that there are many opportunities to affect positive change in the Canadian and international healthcare landscape. Next slide, please. And at HSO and Accreditation Canada, we lean on our partners and subject matter experts as well as patients to guide us in the incredible work that they do to develop tools like the Climate Action Maturity Assessment and the program and to support our work on our standards. Next slide, please. We continue to learn from others and want to celebrate and champion the work being done by leaders in this field. Providing access to resources and best practices is a foundational piece of the Climate Action Program and integrated throughout all elements. Next slide, please. The Climate Action Program allows organizations to see where they're currently at by using a Climate Action Maturity Assessment and making that connection to standards and accreditation. It provides opportunities to have conversations across your organization and across your community. And of course, it's also important to measure the impact on climate resiliency, environmental sustainability, as well as the impact on patient safety and quality of care and what your return on investment is. By looking at your work and actions in relation to that of your peers, the program supports you in celebrating successes and learning from others. We encourage you to sign up and keep updated on the program launch. And back to you, John.
Thanks so much, Judith. I think what we really wanted to articulate, and Judith really did too, and on all of our speakers, is accreditation is not the goal. It's a checkpoint, but really it is about bringing people together, whether it's in an organization or within a community, and to achieve better healthcare for all, whatever that under any circumstance, whether the health system or the hospital is working well and it's stable or it's under stress for a variety of reasons. We have to prepare for it all. And I think at Accreditation Canada, we really think about not just the individual organization, the hospital, but the community it resides in. And that community is also the world expanding and our position within it. So I think what's really Judith also mentioned, and what our speakers mentioned, is we're trying to foster that community and provide, there's many different organizations working in this area and trying to give everybody a framework in which to work with those organizations to achieve a common goal and align our accreditation with that. So I really think that that's what we want is better healthcare and for everyone to be successful. And this is a continual journey. Definitely, and there's lots of different things that are happening. So I appreciate that. We're starting to show how that links to accreditation, and accreditation is just a way for people to judge where they are and relevance to themselves and potentially others. So given that, where we are, and I just thought, we'll bring our speakers back and we'll have some time for just a short Q&A just to wrap up. A little question and answer here. So I think what often, I think we started with discussing or having Chris Johnson talk about her patient perspective. I think one of the important questions that we should start off with is, again, with the patients. And so one question I have, Chris, you've heard this, you've heard lots of perspectives. I think for everybody listening from around the world, what often gets overlooked when considering climate change from a patient perspective?
Thanks, John. I think for me, the key is really about communication and preparation, particularly if you've got a newly diagnosed condition or a worsening condition. As a patient, you're frequently unprepared for how aspects of climate change are going to exacerbate your symptoms, and it can impact your recovery or your self-management because it's not something that we're prompted to do anywhere. It's not something we're prompted to think about. So it's difficult to kind of prepare for or mitigate those effects. But messages could be woven into routine healthcare encounters to raise awareness and to maybe share resources that could help us prepare. And ultimately, I think helping patients prepare helps the system too, because it would mean fewer patients winding up in emergency rooms and primary care offices at peak times when those resources are really under pressure.
That's really, it's when we think about quality improvement, it is usually the most basic thing. Hand washing or is the foundation of cleanliness. I mean, we learned that from Lister from centuries ago. And here, Chris, you've talked about communication, and communication is such the clarity of communication, the frequency and the channels are so important. I think that's really some of the most basic things. We overcomplicate things sometimes with all these things like, everyone's talking about artificial intelligence, this or something like that. But let's just figure out how to communicate better and give people warning. I think my next question really is from a healthcare provider perspective, and thinking about how climate change is thinking about healthcare delivery and patient access. But I'm going to frame it slightly differently for Dr. Courtney Howard. Is we've talked about that particular question, but one thing I'd like to maybe you could comment on, putting you on the spot here, is that we've talked about emergencies in one area, and everyone's backup plan, they usually have an emergency plan as a backup plan, is to go somewhere else. Perhaps, Courtney, you could give some advice for people in their planning about that somewhere else may also have something going on. And so your backup plan may need another backup plan. So maybe you could comment on that.
Yeah, that's a great comment. Actually, when we evacuated, we had to evacuate our entire 100-bed subarctic hospital via military plane down to Vancouver. And we arrived the same day that British Columbia declared a province-wide state of emergency because of wildfires. And so that is exactly what happened. The air quality in Squamish, where I was all of a sudden AQHI 8. And so there's consequences for patients, unfortunately, heading into the summer. Make sure you have 3 months worth of your medications with you. Make sure that you have an evacuation kit ready, and the Red Cross has some really good materials you can access about where to find that. Have a firebox in your house so that your kids' birth certificates and everybody's passports are in a fireproof place. As providers, though, on a systems level, that means that things like interjurisdictional professional licensing is a climate resilience strategy. Interoperable electronic medical records are a resilience strategy, because what we found was when we evacuated, our patients still needed care, and now we were overwhelming an already very busy system, and our docs couldn't prescribe in the provinces where our patients now were. So in order to take advantage of some of the options that virtual care provides us with, we actually need to get our licensure aligned across the country. And I know that that's something also that other folks need to take into account. We also need to realize that providers in these situations, we are also part of the patient population. So our docs were trying to provide care without childcare, without a decent internet connection in the hotel they had evacuated to. And we actually need to recognize the humanity in that. And also when people come back, to make sure that people hand over to someone who's fresh. So it's complex, but preparation is by far the best way to make sure that things go well. And accreditation is, I think, probably the best way to make sure that people prepared, put a little bit of pressure on people before the fire puts on the pressure that makes things real quick.
Thank you, Dr. Howard. Dr. Sargent, Dr. Howard mentioned when you're able to move from one place to another. But in your case, in your populations, the most vulnerable populations, sometimes that's the key issue, is they're unable to move to a location that's resilient. So it might be in a rural situation, they may have a completely opposite problem. So maybe you can describe a little bit how you've handled that and prepare for that.
Yeah, so gosh, so much I could say, John. Great question. I guess I'll start by saying, just listening to Courtney and thinking about all the climate issues that have happened, particularly, I would say, in provinces on the coasts. Clearly, last summer there was a fire in every province and territory, so we're all seeing this. But I think that, when I talk to people in Newfoundland or BC or Northwest Territories, for example, it's much more real for them. I'm in Southern Ontario, and I don't think we fully get it yet. We have not had a heat dome. So, a question put to me by Dr. Diane Maschino, I have to mention her name. She's a resiliency star. She's taught me so much. If we did have a heat dome in Hamilton or Toronto, millions and millions of people impacted, and on day 3 or 4, the power goes out. And I remember thinking, well, that's a bit fantastic, throwing those two things together. But it's actually not, because that's exactly when the power goes out. And our emergency systems, whether it's phoning 911 or calling ambulances or having enough space in the emergency department, we can't all go to the hospital. We have to be thinking about this as communities. And there are examples in Canada, there aren't many, but there are examples of Canada of, let's say, like micro communities thinking together. What are we going to do within our apartment building complex? How are we looking out for each other? The elderly person down the hall who lives alone and has mobility issues, is someone looking out for her? Does she have water? Is she able to cool herself, etc.? We need to find ways, John, to manage this in our own communities and not all go to the emergency department. And we need to figure this out quickly. I do want to pivot quickly, just to throw in a bit of optimism. I work at St. Peter's Hospital within the Hamilton Health Sciences network of hospitals. And pre-COVID, we had an electrical fire. It was one wing of the hospital that unfortunately was just used for storage, but there was an electrical fire, and we had to evacuate the entire hospital, 220 beds, and we did it in an afternoon. And every single physician in the group came in, except one who was golfing, didn't have his pager. We all came in. It wasn't about the doctors. I was amazed at our emergency preparedness of Hamilton Health Sciences pre-COVID and how the entire community, local hospitals, we were able to move people around and get people to other places. And then, of course, we've learned a ton from COVID. We know a lot about this, but we need to make the switch to applying this to climate issues.
Well, thank you very much for that perspective. And I think we've really covered the gambit here, and I really want people to join a community, feel like they're part of a community, and feel like that community has impact. We're in it together. And at Accreditation Canada, we want people to be successful. And everybody on this call, on this webinar, would like people to be successful. And we'll be successful by sharing stories, sharing insights, and also and taking action. And hopefully we're providing ways to giving you a roadmap to take action easily. So please sign up for our climate action program. We ourselves are going to be partnering with other groups as well. This is just the beginning. And I really encourage everybody to evaluate our webinar today, because with evaluation, just like accreditation, we can improve. So please, there'll be a feedback evaluation form, and I really encourage everybody to use it. I thank everybody for attending, wherever you are in the world, and we're in it together. Although we are talk about Canada, some of these exact issues are in other regions of the world. They may look a little different, but we're all facing different challenges and similar challenges, and we all have ideas and approaches to address them. I'm very, as Miles said, ending on an optimistic tone. I myself am optimistic, even by this webinar, hearing all the things, even knowledge is being better prepared and gives you optimism of how to tackle things. Hopefully we see you in a hospital or a healthcare facility near you, if either accrediting or seeing how excellent care is being delivered. So thank you for your time today and take care.